them came from Wikipedia. Oh, a lot of mine came from Wikipedia. I mean, I think Wikipedia is a great source. I used it a lot for myself to remind myself about things that I was trying to teach. And I did checking on the big picture data and some of the primary times, years in which, acts occurred and things like that. So it was useful. It was helpful for me to kind of get my head around social services and health, as well as the health services too. And I hope it helps other people. And if you have any questions, I'd be happy to answer them.
I do, and
Okay.
I think let's give everyone a chance to introduce themselves just very briefly, and maybe you could start off with a brief summary of what you uncovered, because I think the discussion we have today, at least from my perspective, is informed by the history. What's in the document itself. So I wonder if we could just spend 1 minute. I don't know if everyone knows everyone. So I'd like to ask you to very briefly introduce yourself. And if you want to, you're not required, but if you want to add one theme that you would like to discuss today, we can keep track of them so that we, some false sense of control, we could potentially manage the conversation and try to address the interests that people have. So Sam, do you want to go first?
Okay, sure. I'm Sam Getzinger, and I'm hoping that we get some information that helps us persuade others about the need for social justice, which includes healthcare in our country. So that's my hope.
You want to just ask someone else and we can go around like that?
Oh, sure. Let's go with Ty.
Thank you, Sam. Well, and thanks for the opportunity to learn about this aspect of 2025. I'm interested in learning about the limits to the executive authority and changing what's legislatively been approved. I sit on the Community Mental Health Board and concerned about the massive cuts in Medicaid and how that's impacting the delivery of services for both mental and physical health for the most vulnerable populations. And I'm just trying to understand where we're going. And before we end, I wonder if we might talk about how the Secretary of Health and Education or Health and Welfare can swim in the sewer and still be the leader of the health movement in the nation.
Someone else want to introduce themselves?
And Rick Cross, would you introduce yourself?
Sure. I'm Rick Cross, and I am one of the founders of this book club because this book is having such an enormous impact. I think in this particular chapter, what Karen and I were talking right before, after rereading it to get ready for the meeting, and it seems like it's one of the chapters that really they're basing some of their arguments on some really wacky stuff, and it's each chapter has a different author, and so. But this one seems really inconsistent with whether you like the facts in some of the other chapters. They are facts. I mean, they are relying on real data. In here, they're just relying on conspiracy and other theories, and it just seems kind of crazy that it could carry any water. But it definitely is carrying water, because if you look at it and you look at what's happening, the parallel is there. I mean, it's the parallel's there. So that's my interest in this chapter.
Someone else?
Well, I'll go next. I'm Marian Kromkowski, and I just learned about this. I didn't know it was a book club. Learned about this book gathering just recently. So this is my first time on the call. I haven't read all the chapters of 2025, mostly summaries, but so, I think I'm more going to listen today and see, what your format is and how you go about discussing these things. But it does appear every day on the news when I have the radio one on the card. I mean, today they're cutting back funds for farm to food programs for kids' healthy meals. And whoever was talking about it, from the government said it's just, something that just isn't needed. Well, it's needed. It's a question of who's going to pay for it. And is the public going to step up and, private donations and cover this, or is the government going to get its census back and reinstate these funds? So that is me, recently retired, Marian.
Thank you. Marianne, you started to talk, but we're on mute.
Pardon me? I didn't hear you.
There's two Mariannes.
Oh, I'm Marian Kromkowski.
Yeah, and
Thank you.
that's okay. We have two very similar names. I'm Mary Ann Borton. I'm a nurse by education and worked in the pharmaceutical business, did pharmaceutical research, and also as a public health nurse for a while. I've done a little bit of everything, but when I read this, I can't deny that there isn't room for improvement in a lot of these programs. I think what really bothers me is, to see that really a lot of the effort here is not only cost cutting, but to sway all of the support towards family, and family is by their definition, right? It's man, woman, and child. That's it. There's no room for anything other than that. And I think that's, to me, that's the biggest concern I have with this. And I'm also concerned that kind of control that is sought will also govern who gets healthcare and who doesn't, and what's covered. So that's part of what I was thinking as I was reading. I didn't get through the whole thing, but that seemed to be sort of the recurring feeling that I had. And that's sort of, I'd be interested to hear what others are thinking. I think it's the control over the lifestyle and using healthcare as sort of a stick to keep people in that box. So that's sort of where I'm going. But I do think we can't deny that there are a lot of programs that could be run more efficiently and could be done better, but not this way.
Jill?
I agree with Mary Ann. I think that was the dominant thing that I saw. It kept reappearing, family, mother, father, adoption only to mother, father, all this kind of thing. That was, overpowering in this. And there was one line which I thought was very prophetic, because this was written a couple of years ago. They said they were going to go after, waste, abuse, and, corruption with AI. And I thought, oh, wow, there it was right in front of us. We should have known.
Kevin?
Yeah, Kevin Weber. I'm a retired family physician, so I at least had a passive relationship with these agencies. And yeah, I sort of agree with Mary Ann and others that most of the emphasis is ideological, and it's sort of turned into an abortion monitoring, or CDC is sort of turned into an abortion monitoring agency, and the elephant in the room is that there's no mention of tracking statistics on gun violence. But there are also, scattered about here and there are issues of eliminating conflict of interest and improving efficiency and incentives in ways that sound, kind of legitimate. So I'm concerned that the most of the efforts will be directed at the ideologic transformation and not very much at the efficiency level. So we'll see.
Thanks. Karen?
Yes, I'm kind of in Kevin's camp there and also in Jill's because of this use of AI. I mean, and then at the same time, we have the Doge department, and this is AI on steroids. And and by saying an ideological perspective, what they're saying is not fraud and abuse, but what's going on is fraud and abuse. So as long as their morality checks what they consider pro-life, and let's get rid of Planned Parenthood and all kinds of other things, vaccines and what have you, because they've used fetuses or something to create these vaccines. And it's really wild. The other thing that the chapter itself covers such huge topics. You could delve into just the vaccines. You could delve into just the anti-abortion, anti-Planned Parenthood kind of thing. And so we're going to be touching on several of those aspects. So I understand why, you kind of wanted to know which aspect each of us was primarily interested in, is to kind of sift it down so you can cover it in an hour, I guess.
Yeah.
Anyway, that's my thought.
Gary? Miss Eater, my
Sorry,
partner.
at the, this, I don't want to creep you guys out, but I'm literally just listening like you're a podcast and hoping to glean something from your conversation. That's all.
Rebecca, you have two people on the screen. So is the other a silent partner? Would he like to say
Oh,
something?
this is Marty, my husband.
Yes. Hi, everyone.
I guess I should say what I'm most interested in this, and why I kind of went back to look at the history of this is, I guess as somebody who studied, executive administrations, I mean, exactly what one of my questions is exactly what the president and or Doge and or other people in HHS can do to just cut these programs, and because some of it is just the difference between discretionary and mandatory expenditures. Some of these expenditures have to be reappropriated every year. The majority of them are part of the initial legislation, and maybe that legislation runs out in 5 years and they have to reauthorize or whatever. But it to some extent, it's because Congress is not doing their job to to maintain their authority and their decision making on this, and so theoretically, could the president or whomever just cut this stuff and nobody say anything, unless it's taken to the Supreme Court or something. And so, I mean, that's kind of why I sort of looked at this. I mean, to some extent, as I'm reading, and this is the first time I've read any chapters of this, it sort of strikes me as spaghetti being thrown against the wall. It's like, are they really going to do all this stuff? Or is this just a way of verbalizing some of the ways in which they might try and meet these objectives that are in the forward or in the front of this chapter? And so much of it as I'm going through, there's a couple things I'm going, well, no, that's wrong. This assumption is wrong. But and then there's others I'm really dubious of. So it's like every page there has to be, I want to go back and do a fact check to see, as Rick was saying, I mean, so much of this is BS. So that's kind of where I'm coming from in this. And I just wanted to know, I did these 2 files because I wanted to know what reality was.
Well, if you find out, do let us know. So I'm Mickey Eater. Sam asked me to help lead the discussion today because I am an NIH-funded researcher. I've also had research funding from the CDC and Agency for Healthcare Research and Quality. I'm about to retire. I'm in a medical school as a faculty member, and I chair an institutional review board, so I'm very interested in research ethics. The parts of the chapter that stuck out most to me, and I think I'm not in a position to talk about what funding can and can't be stopped and started, and I think it's made really complicated by the fact that the Congress has not approved an annual budget for a number of years. So some of the projects I've been involved in have stopped and started over the years because they're the threats or the actual shutdown of the government for a couple of days means that you can't spend federal dollars, and that's been really annoying. I'm interested in not only the ideological parts of the chapter, and from my point of view, how religiously motivated and problematic they are in terms of applying across the country to the population, but also the reliance on market-based solutions. There is a concern in the country, particularly among some of my colleagues and there's no discussion of single payer in here. There's also no discussion about the management of large healthcare organizations by people that know little to nothing about clinical care. They do know a lot about economics and the costs of things, but it can be very difficult to understand how to make decisions about what to support and so on. And I think the issue of market-based solutions is tremendously problematic. I'll just say one other thing, that the discussion currently going on in Washington about what to do with Medicaid and the potential for block grants is particularly disheartening because of how easy it is to use those funds in ways for which they are not intended. I did do a little work today trying to understand Medicaid in Michigan because I'm actually on the faculty at the University of Minnesota, so I'm much more familiar with the dynamics of healthcare in Minnesota than in Michigan. But I can tell you that about 670,000 Michiganders are recipients of Medicaid or supported by Medicaid. Their healthcare is. And unlike some other states in the country, less than half of Medicaid recipients in Michigan are members of racial and ethnic minorities. So we really are looking at a population that is supposedly supportive, rural 35% of Medicaid recipients are rural. The majority aren't racially and ethnically. The majority are white. Let's just use plain language. And so the idea of how the ideology fits in with the population is something, or doesn't fit in, is something I'm interested in. And Rebecca, I'm going to turn it back over to you, but just with one kind of framing device, because I looked at the material you shared. You went back to the great, the word just went out of my head.
Great Society.
Great Society, Roosevelt's program. And
Oh.
it's a good reason. Well, even before Johnson, you went all the way back to the 1930s.
Yeah.
Roosevelt.
The government should provide goods and services for the benefit of the population at large, is one reason why we keep hearing from the Republicans of concerns about socialism. And it literally goes back to the programs of the 1930s.
Mhm.
So I think that that can be juxtaposed to the idea that there are market-based solutions and we are all function as individuals in markets is problematic in terms of obtaining health care. So,
Mhm.
but perhaps you want to say a little more about what you uncovered.
Again, it's just a historical aspect. 1935 was the Social Security Act, brought in by Roosevelt, who three primary programs: unemployment insurance, old age survivors, and then the federal state public work assistance program. That AFDC was created essentially back in 1935. I mean, and there were so many, and actually there were so many, quite a few fundamental changes. Although from 1935 to Johnson's War on Poverty, 1964, there wasn't much done. President Johnson's War on Poverty, the Economic Opportunity Act, and Title 14 amendments to the Social Security Act established, actually, Medicare and Medicaid was established at that time. And then Medicaid provides much of the financing for the healthcare coverage insurance for, obviously, for lower income people. 1973, Congress combined, and there was a lot of combining of things. I had a little blurb on here on the history of the Social Security Administration. It was combined with HHS for a while, and then it was pulled out by Clinton. Education was in there. Educational services was in there for a while. And like I said, 1973, supplemental security income. There was some of the things were sort of thrown into there because of Title 20. 1996 was a huge welfare reform, the Personal Responsibility Work Opportunity Reconciliation Act, signed by Clinton, which replaced AFDC with TANF. Temporary assistance for needy families.
So let me chime in here and from this, let's compare this, the Great Society and some of the legislation with Lyndon Johnson, and then look again at Ronald Reagan and the whole concept of the welfare queen, and that the government is the problem. So there we have in pretty obvious comparisons between these two ideologies. What Ronald Reagan brought to the table is sort of another kind of wedge into the idea of the nanny state and those kinds of, I mean, these kinds of ideologies have been simmering and bubbling under for
For a very long
decades,
time.
you know, with the right-wing think tanks, the whole concept of anti-science, which, you know, back in the 80s and 90s, you had, what was the senator's name?
You think?
No, who was in charge of a science, you know, committee who didn't believe in it. And you had the anti-intellectualism, you know.
Well, this goes back a long
This
way.
goes back to 1967. Richard Hofstadter wrote the benchmark book on how America is essentially anti-science and anti-intellectualist. I mean, so, and these kinds of ideologies just needed a conduit and needed approval, essentially. And here's where we find ourselves. You know, Project 2025, I think, is a culmination of decades of all of this, you know, opposite of the kinds of things that Lyndon Johnson was trying to put forth in the Great Society and the War on Poverty. So, you know.
Well, so, okay, so there was a huge, reform of some of these programs under President Clinton. The Children's Health Insurance Program he implemented, and then not much happened until the Affordable Care Act, in which there was a number of changes in the healthcare market. Trying to look at my things here. They created the health insurance marketplace, and there was a huge expansion of Medicaid into the state levels. And, just kind of a couple of people have mentioned the healthcare market. It's obvious to me as I'm reading this chapter, there's no conceptualization that the healthcare market is not a private sector market. And industrialized countries that have central healthcare have kind of realized this. And when you put insurance into a marketplace like this, it doesn't work right. It puts the incentives in the wrong place. And so you really can't have totally private sector. I don't think you can have totally private sector solutions to healthcare. It just doesn't work in the market.
So I think what you're really providing is a kind of foundation for why there's so much in this chapter.
Yes,
the attempt of politicians to address needs in society going back to the federally qualified health centers in the 1960s was really, and this clinical safety net was really an attempt to say we have to provide and support access to care for the population because the market isn't managing that very well.
It can't. It can't do it. Like I said, industrialized nations realized that many, many years ago. And if you look at research on when Britain's and maybe Canada's too, although I haven't seen it, but when Britain, their NHS, when that came online, all the things that changed from infant mortality and all kinds of diseases and all kinds of stuff, it was huge improvement, in the healthcare post World War II.
Well, let me just add one thing that isn't discussed here, and I don't know if people are familiar with it or not. United States per capita spends 2 times or more per individual than any other modern industrialized country. And so there's a group of 30 countries that are often compared to each other, OECD countries. Most of our health outcomes are in the bottom half of that group. Yeah. So it's not for want of money that we have the health care that we have. And so that's the kind of background that we have the attempt to produce program after program to address needs. There is no real theory of health in this chapter that I could find anywhere. So,
or it's a really warped one. It's really not accurate. And, maybe that's part of this administration's way. I mean, obviously it is. You say things that aren't true, and then you base what you do on these things that are not true. I mean, there's so many examples of autocratic regimes attempting to do, this is one of the ways in which they try and accomplish things.
So my pulmonologist, in answer to my question about, isn't socialized medicine, as in the UK, do you approve of it, or what do you think about it? He says, they tend to be way behind. In America, we tend to be more innovative and creative. And I'm thinking to myself, yeah, because we're getting funding from the federal government in many cases to be innovative and creative. And so Project 2025 is intent on removing that funding. So we're going to end up, even worse than we are now.
Other people want to comment.
I just want to know how we make this clear to people so that we can actually begin the change. How do we make these stories? So let me give you for instance. Last night, I was at an event called Speaking Truth to Power. And it was actually a good friend of my husband's, Taro Yamasaki, who did photojournalism for many years. And one of his slides was about Ryan White. And he photographed Ryan White, during his life and right up to his death. But what happened during that is his photos and the story of Ryan White's story became a national headline. And Congress actually passed the Ryan White Act that still today funds AIDS clinics in the United States. So here was a photojournalist who did a story, did it really well, and it actually changed legislation and the country moved forward. How do we take today's stories and do the same kind of thing is what I would like to know. Any ideas on that? Stop laughing, Carrie. Or Mickey.
Oh, no, it's hard to talk about this chapter. My initial thoughts, and Sam, I'm going to answer your question, but my initial thought was, gosh, this is really terrible for women's health for a number of reasons. Partly the contradiction between wanting transparency and limiting people's access to proven therapies is really difficult to reconcile for religious reasons. Sam, I think we've seen examples of what you're concerned about, which there is something called EMTALA, which is a requirement that if you present at a hospital emergency department, they have to take care of you. They don't have to admit you and heal you completely, but they can't just refuse service to you. And so the idea that we are potentially going to look at a large part of the population who doesn't have ready access to health care is going to mean, most likely, based on past experience, that people are going to end up in medical crises and health crises, and they're going to present at emergency rooms. 20 years ago, we had a number of hospitals that were either closing their emergency rooms or they were deciding they would no longer be level 1 trauma centers because it became financially impossible but also because it became impossible to manage the number of people who were showing up and providing them care, because the emergency room is not designed as a place for people who have neglected their health to show up and become stabilized.
That's interesting
So,
because in my 20s, I was refused care at 2 emergency rooms in hospitals in Detroit because I had no insurance.
so I think that's going to be a big question going forward if we limit Medicaid. It's not in, I don't think that some of the cost-cutting activities were on the radar of Mr. Severino, who wrote this chapter, who had been the director of the Office of Civil Rights in the Health and Human Services area under Trump 1. That anyone imagined that they would be trying to pay for tax cuts by refusing services to citizens. I don't know how we make that plainly, statements like that without sounding like we're attacking the president, which is a problematic position for some in our society to accept, that he may be making poor choices or allowing people working for him to make poor choices.
Mm.
But I do think it's a big concern. Jill?
No, go ahead. I was just gonna say that one of the things we really want to do is to stop this from happening. Unfortunately, telling stories doesn't stop it. It happens, and then we tell the story, and maybe we can get it through. And it's a frustration because you know this is going to happen to people, and maybe in these rural hospitals in Michigan where the population of the county is red, let's face it. I mean, we know how our counties are up here. And so it's really hard. I mean, until they pass the reconciliation or whatever they do and literally take that money away from places that need it, and then they start losing these things, then you get the stories. But unfortunately, people are suffering by that time. And that's the frustration that we have. I also thought it was very interesting that they're talking about, Medicaid cutbacks. And yet at the end of the thing, they start talking about how they have to support rural hospitals. Did they not realize that the rural hospitals, I mean, in some areas, they depend on Medicaid. If they lose the Medicaid, they're not going to stay. So I don't know how you support a rural hospital and cut Medicaid like they're planning to do. But anyway.
I mean, there was so much that was contradictory in these chapters. Oh my God. Yes.
Anything we could imagine saying? A number of people commented that they were, I don't know if disturbed is the right word, but found the discussion of family and a particular vision of the family that fits into the DEI issues and all kinds of other things. But is anyone think that that's a potential way of introducing concern? Is that a fair way to put it, Sam?
I think Ty Wessel might have something to say about that.
What would you think I'd say about that, Sam?
I'm pretty sure I know, but the rest of the folks might want to hear it.
I'm not sure. I am so confused. I was listening to Stateside today on IPR radio, and I was getting ready today for my mental health board meeting tomorrow, and this program on Stateside today was about the impact of Medicaid cuts to an already busted system. 57% of our kids with mental illness are not now qualifying for any service. And just think where we'll be when when the budget is finally approved and we eliminate Medicaid further. I don't know that I have an answer, Mickey. I don't know.
Things I attempted to try and find, and it was just too tough, is to what extent of the Medicaid funding goes through states and what is from the feds. You know, so my look at these fundamental changes, these acts, these laws suggest that and indicate that the Medicaid funding has primarily devolved to states levels, and states are now have to spend the majority. I mean, spend the, in terms of, you know, the amount of money that people receive, I think the majority of it now comes from state governments. I don't know about that. And I think and the problem is every state's different. You know, so now as these changes come about, it's not going to be just one healthcare system for everybody. It's going to be 50 different healthcare systems. You know, I don't know how that functions. I don't know how that works.
And I think if we read the fine print, much of that state money really is a block grant and other grants from federal government. So even though they're saying it was state dollars, it originates, I believe, Mickey, you can keep me accurate on that, but I think much of it started at the federal level and is allocated to states to disperse, and then it becomes state money.
Yes.
So just to add a little bit to that, one of the things that is occurring in the background, and Kevin, I hope if you understand payment structures, you'll chime in as well. The federal government under the ACA gave block grants to the state to support individuals to obtain health care by providing kind of money that allowed them to make up the difference between what people could afford to pay. So a lot of it is income tested. If you can demonstrate that you are 130% or less of the federal poverty line, you then were eligible to get reduced payments. You could get health insurance. What the current administration did previously when they in the first round, and I have no doubt it's going to happen again because there's been discussions of it already, is to say that one way to make things affordable is to provide less services. So where the ACA said insurance companies have to pay for a number of preventive services, vaccines, for example, an annual visit to a doctor, cancer screenings. If you eliminate those, then you can say you can buy insurance for much less, or you can buy insurance for much less if you're allowed to say that you have an $8,000 or $10,000 deductible. Not very helpful if you're already struggling financially to be told that you're going to have to assume the majority of the expenses if you want to go see a doctor. And what that ends up doing is people defer care then, and everybody becomes less healthy. And I can tell you someone mentioned the National Health Service before, the English system. A few years ago, they expanded access in the population. And it did end up costing a lot more initially because people had deferred care. And so if you're not very healthy, it costs money to get care and to obtain the kinds of services you need to become healthier. But that was not factored in very effectively early on, and I think it has proven to be a anecdote we may hear again about how well the National Health Service tried to expand access to care, and particularly primary care, And it just ended up running a big bill. And in the short run, it did, but it's not clear that in the long run that the additional expenses would be sustained.
So Mickey, it sort of seems like as a country, we actually don't care who gets health care. You know, it seems like the rich can get health care and the poor, well, that's their bad choice because they chose to be poor, so they don't really deserve care.
Well, part of what's happened is that the ability of companies to employ people at almost full time has meant that fewer and fewer people have access to insurance through their employers. And I'm just kind of providing a variant to the story you just outlined, Sam, that, yeah, if we're in an environment where our healthcare is often determined by who we work for. And part of those programs from the 1960s were attempting to provide a public doorway, a doorway that the public could go through in order to access care. So the federally qualified health care system, I looked at it. It's I don't know if I can share my screen or not, and I don't know if this is of interest to people, but let me see if I can find one. Oh, sharing is not turned on. You're on mute.
You know, one other thing I wanted to mention, I think
There we
healthcare.
go. There-
Oh, I think.
There's the screen.
Okay.
Go ahead.
This is
Oh,
this is
Go
this
ahead.
is what, if you imagine we're in District 1 or in Legislative Area 1 in Michigan, there is a fair number of, all of these red dots are clinics and the yellows are the kind of headquarters, because you can have an organization that'll run more than one federally qualified health center. So it's not as if it is all located in the inner cities or urban areas of Michigan at all. And this is really the kind of healthcare that's in danger through Medicare cuts.
Well, that seems like a really good visual.
Mm-hmm.
Mickey,
one of the things
Mickey, I have a question, and it's not about healthcare. I'm more optimistic about healthcare because I think the public outcry is going to be so loud that we're going to see the same reaction that we're seeing yesterday and today about the plane given to the White House. And I think we'll get back on track with providing health care. But what happens to health research in the interim? What happens? What's the impact there? When are we going to ever be able to catch up what we lose if we stop doing the research and we lose our best researchers?
Oh my goodness. You're asking me to look into a crystal ball. What I can tell you is that the research is a multi-layered activity. So I think most of us think about the NIH. And when I try to explain research to people, I say, well, the NIH is interested in discovery. They want to learn about new therapies, new devices, new ways to address clinical problems, some of which are incremental. In other words, we want to devise a way to produce better outcomes for more people, even though we may have a solution already to a clinical problem. But then there are other agencies in the federal government that are involved, like the people don't think of the CDC as doing research, but they do, because the part of the chapter that talked about separating out data collection from public health recommendations, well, that was in a kind of a balance. You wanted to know, for example, who got vaccinated, so that if you had an area, we're having a measles outbreak right now, and we're finding out that there's pockets around the country in which there are vaccinations, childhood vaccinations are lacking. So that was a kind of a research, and you could say it was quality improvement focused. The answer to your question is that it takes a long time to learn how to do research. We don't really train. When I started working in a network of federally qualified health centers creating a research program in Chicago, I surveyed the 187 doctors that provided care in the 45 sites that constituted this organization. Only 2 had any research experience at all. And so the answer to your question is, it takes a long time to really learn how to do research. And it's usually done after people finish their clinical training. And there are probably, the NIH offers 15 to 20 different kinds of grants in the $35+ billion they spend a year. Some of them are training grants, and it supports clinicians. It'll pay 75% of their salary for 5 years, and that's their opportunity to learn how to do research. And they usually do that by participating in a training program at an academic health center. So we're in danger of creating an environment where people don't see research as a viable career because there's no support for them. And I can tell you that the discussion that's going on right now about the outrageous indirects that universities get, and they want to only provide 15% to support research. I'll say 2 things about it. The first one is there is waste. A number of people in commenting, the nurse, Marianne, who I think we do waste money in our universities. At the same time, we have to provide people access to libraries and scholarship in order for them to be able to say, what don't we know about a particular subject? And that's what I ought to be doing research about. So we're potentially burning the candle at both ends in terms of not providing access to the resources we need, and also not providing support to train researchers. There is an area that if I were in charge of HHS, I would like them to spend a little more money to learn how to implement what we already know and affect the relationship between the evidence that we've generated and its application in care contexts. Because it's very difficult to take new knowledge and train doctors who have been out of school for any number of years and have them accept that there are different ways of doing things. In fact, there's a program called Choosing Wisely, which is started by the American Board of Internal Medicine, but now involves about 80 clinical professional groups. And they're committed to identifying 5 things that they recommend to their patients regularly for which there is no evidence to support those recommendations. And One that sticks in my mind is that people who suffer from back pain, they'll go to a doctor, surgery may be recommended to them, but we know that the evidence suggests, because it's been collected in the last decade, that about half the people who show up at their doctor with back pain do just as well waiting 6 months and doing certain amount of physical therapy and exercises than the outcomes of surgery. So helping people, developing strategies for translating evidence into practice is something we don't emphasize enough in research, but we do spend an inordinate amount of money learning new therapies and new techniques for providing care. And so I think that's going to really erode as we go forward because it's not going to be paid for. What we will see, though, and this depends on what happens with the pricing with pharmaceuticals. People don't recognize right now more than half the research that goes on in academic health centers is pharmaceutically funded. So it doesn't mean it is biased. And part of, I mentioned I chair an institutional review board. Our responsibility is in reviewing proposed research and making sure that the individuals who are potential participants in projects, that the balance between the potential benefit and the risk they're going to be exposed to is as beneficial as possible. So we are trying to protect people from research, and I don't think that we've done a good job of explaining that aspect to it. But I do think that the limitation in resources is going to severely influence not just research, but potentially clinical care, because the majority of our academic medical centers fund themselves and fund some of their educational programs out of the research dollars that are provided. So it's going to be a bit of a challenge going forward. What we will potentially see if these cuts become reality is that the people that are doing research and teaching in medical centers will end up providing clinical care. And again, the translation of new evidence into practice will then slow down because that would be something that they would not be supported. It's research that supports the innovation and the awareness of new therapies and the development of new therapies. And if that slows down, then we're going to lose the potential for innovations to be brought into practice.
I have a question or a comment. One of the things that's, I think, really alarming, of course, we have a non-medical person as secretary of HHS and a conspiracy theorist, and he's an environmental health lawyer. But how much impact do you feel that having RFK Jr. as secretary of HHS will have on the research community? I know he has ordered that some research be halted. Who knows what that's about or if it'll be resumed. Long-term research being halted isn't necessary just to start it back up again in a month or two. I mean, you're jeopardizing the whole study. So I don't know how much damage will be done during his tenure. Hopefully it doesn't last the whole term. But what impact just this man alone in his approach and his beliefs do you think will have on the research community academically?
So let me turn that around and ask other people on the call. What's your response to having RFK Jr. as the secretary? When I was talking to Sam earlier today, and she was re reporting on the talk she went to yesterday, and the impact of photojournalism on people, seeing things and processing them. I think there's a very similar challenge when you hear the ideas that the secretary is espousing. We don't need any more evidence about the safety and potential value of vaccines and whether or not they cause autism. That is a terrible waste of resources. But the fact that it can be introduced to the public is incredibly powerful. And I can tell you, having done research on vaccine hesitancy, if you don't have a huge megaphone and the ability to communicate to a large percentage of the population, you have no chance of getting your message out there. And so I think just listening to the guy and hearing some of the kind of ridiculous ideas, I don't know any other way to put it, the ridiculous kind of pop theories about causality and relationships between the additives in vaccines and autism is incredibly harmful. And it just erodes people's confidence in the medical system. Jill?
Yeah, Mickey, you know, that part of what they were doing in there was actually hacking what the CDC had done during COVID, and how, you know, Fauci and everybody had given them the wrong messages. And I don't think they had any concept that when you have something new and you're doing research, you tell somebody what you think, but part of what science is you discover new stuff. But it seems like they were trying to undermine the true scientists' comments. And now we have somebody out there who they may believe even better because they like what he's saying. They're going to believe him instead. But it felt like they were really attacking Fauci and was it Collins and all the guys that were out there for us during COVID.
It's 6 o'clock. I could understand if people want to leave or have to leave. Jill, I'm happy to tell you a story. I had an opportunity to sit down with Francis Collins one day when I was at a conference in Washington. And one of the things we talked about was the failure of scientists to acknowledge that they were starting from the same place as everyone else. If you go back to March of 2020, they did not couch what they had to say with statements like, this is preliminary, or we are using analogy based on what we know over here to make recommendations. And so masking, for example, could have been handled very differently if they would have started out. You know, there were theories about, and some of this may be true, a lack of protective devices available in the healthcare system because they had decided not to spend money on it, may have meant that they did not want the public to go out and consume all the masks because they genuinely were needed for healthcare people. I don't know if that's true or not, but I do know that we did not do a very good job of saying that we don't know enough about this to make solid recommendations. And I think that was a big mistake on the part of the scientists at the time. I'll also remind you that Trump was standing at the lectern every day, pontificating and making it difficult for them to share opinions. But it's something, I don't know, I felt like the conversation with Francis Collins went somewhere because I don't know if anyone saw him on Colbert. but he did actually acknowledge that they had made mistakes in managing that in a public environment. It's maybe too little, too late, but I do think that we didn't do a very good job of managing the situation.
It was like they had an assumption that everybody they were talking to knew what the scientific method was. And that what you start out with is a hypothesis, and then, you change it as you go along. And you're right, I don't think they did do that, because people jumped on it at first, and then every time they said something different, they would play what they said before, which made sense why they had changed it, but most people they didn't really understand how that worked, I don't think.
Yeah. The other thing, and this makes me nervous, and we don't do a very good job of teaching science in our K through 12 curriculum. I think we have substituted information retrieval and memorization for teaching people how to think. And so, for example, when the project I mentioned before about vaccine hesitancy, I used to go out and show people that the data that vaccinated people who got the COVID-19 vaccine were less than 10% of hospitalization cases, and again, 10% or less of people who ended up in the ICUs, so intensive care. So we never really explained to people that vaccines don't always absolutely prevent you from becoming ill, but it can prevent you from the severity of the illness can be a lot less severe. And so people weren't convinced that the vaccine, because people got sick, I literally would have conversations in public forums where, well, if I'm going to get sick, well, then there's no reason for me to take the vaccine. Even after showing them that, 9 out of 10 people in the hospital were not vaccinated. So you're really improving the likely positive outcome you're going to have if you were to get vaccinated. So we haven't taught people how to take information and translate it into their own life as effectively as we need to. And I don't know how to do that either, sadly. Since everyone's stuck around this long, if I can keep you for 5 more minutes and just open up the floor, how do we think about messaging? We're going to have a No Kings Day demonstration. We're going to have the opportunity to have signs out there, which ideally will be photographed and shown in papers and on the local news. What kinds of messages do we want to try to share with people based on what we've talked about today or what we're thinking about? Rick, could you come off? Can't hear you.
I was going to say something.
I guess the space bar doesn't work. But, I was thinking about what Jill was saying, that if the strategy of the message is to tell stories, it's assuming that there's already harm that's been done, because the story would be talking about a loss. And so what is the strategy that we can be more proactive in terms of telling people what's coming? And I think it's really tough, because I think what upsets us about what's going on differs between who we are. The thing that's most upsetting to me about what's going on is the abandonment of the rule of law. I mean, I was raised in a family where the rule of law was a very big deal, and we were reminded of it every night at dinner. And everything that I have learned about the system and how important it is for us to be free people, to live in a society that has a rule of law is apparently gone. Yet, when I think, so is everyone as upset about that as I am? And I think the answer to that is clearly no. That there are many, many people who could care less. And so that gets you back to we have to look for the impacts, and therefore we have to accept that harm's being done. But I can't come up with any general message that's going to impress, other than stories about real impacts and how people are being hurt. And I think we're going to see that in District 1, but not yet. And I think the health area is when we're really going to begin to see it. And I'm a veteran, and I'm interested in what's going to be happening with the VA, because so many of the, particularly Upper Peninsula, there's a lot of veterans up there, and they're going to be hurt. And those are stories we can be telling. But I think what Jill pointed out is we're not getting ahead of it. Then we're kind of talking about it as it comes along. And I quite frankly don't know how to get ahead of it. I'm just telling stories when I hear them, but I haven't come up with anything yet, because again, to repeat, what's important to me, that it keeps me up every single night. Most people, a whole lot of people just flat don't care about it. It doesn't matter to them. So it's a really, Mickey, it's a really tough question. I don't know how to answer it.
I think one of the problems, Rick, with this rule of law in my whole career has been criminal justice, basically, and watching Don the Con get away with not obeying the rule of law for years and years and years. And it really hasn't affected him. I mean, now he's the president. And I, as somebody who believes in the rule, in the spirit of the law, say, why should I? Why should I obey the rules? He doesn't, and he gets away with it all the time. Why should I? And I don't know if that affects other people who don't even have that passion about the law that I do. You know, how do they feel about it? I don't know that it answers your questions, but that's just my take on it.
Maybe in addition to science, we need to teach more civics too, so people understand the importance of our system of government and laws and why that matters, and why you can't have kings and things like that. I think that's, a lot of people don't sort of get that.
But I took civics in school. All of the people that I graduated with took civics in school. It took with me, it didn't take with, I mean, the group of people that I graduated with are good friends with Betsy DeVos and Terry Lynn Land. In fact, one of them married Terry Lynn, Dan Hibman married Terry Lynn Land, and they all had the same education that I did. So I don't know. I think it's more than just teaching civics, and our parents were taught civics. In fact, my father joined the Navy in World War II at age 17. He signed up until the end of World War II. So I'm not sure. I think yes, I think we need to. I didn't know that we were not teaching it anymore. Rick,
I don't know.
maybe you can address that. Do they still teach civics in school?
Yes, 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 they do. But on another note, I just want to say, I think it's really immoral when your doctor retires. Dr. Weber was my doctor, and he retired, and unfortunately left us, our whole family, having to find other doctors, none of which have been as good as Dr. Weber, I might add.
Immoral? You're saying that's immoral?
So I think that's immoral for your doctor to.
Yeah, I agree. I'm guilty.
Thank you, Kevin. But luckily, he's taken on a job with the Leelanau Dims, which I feel is quite important. So, and I do think it's important to remember that we do have hope, that we can do things, and that, you know, what I saw last night from watching what happened with photojournalism and how it changed so much of the world, we can do that. And so I don't want people to feel discouraged because we don't have exact answers. We just keep trying. We just keep trying to get out there with stories. And I was actually thinking that maybe, Mickey, you should be on a podcast because I loved the way you talked about research. And I don't think a lot of people think about that. You know, having gone to the Mayo Clinic one time, I remember thinking like, oh my God, medicine could really work if we only had more institutions like this. And why do we have that and not anywhere else? Why doesn't Traverse City have a Mayo Clinic? You know, why don't we have things that
Because we
work?
don't have Mr. Mayo.
Well,
So as far as messaging goes, so I feel the same way as many of you, is that how do we get messaging to kind of create a groundswell of some kind or any kind of movement? And that is, you know, the number one question. You know, I keep thinking back to the one ad that was shown once during Johnson's campaign in '64 of the little girl pulling the leaves off the flower, and then in the next there's the picture of a nuclear explosion. I mean, what an effective message. And it's how do we, or and how do those who agree with us generate messaging that can change minds? And while at the same time, those minds are being massaged by the spewage of, you know, the right-wing networks, Fox Noise, and et cetera, et cetera. So that is a very, very difficult question, and it's a very difficult thing to kind of get a handle on. So, so I have to, you know, what? Also, I wanted to mention that in the Atlantic today, there's an excellent piece written by J. Michael Lutig, that judge, and it's entitled "The End of Rule of Law in America." And it's outstanding. It's one of the best pieces I've read about what's happening here with us. One of the best things I've read in a very long time.
I want to go back to your messaging because about how to approach it or to put it out there. The messaging is not a yes or a no. It's not a black or a white. It's that gray, and it's very complex. You know, a lot of what we're running into isn't just, you can't just say, well, 1, 2, 3, 4, and boom, you got it. It's not that way. Like Mickey, you're talking about research, and research is going to depend on, like you talked about, the training and how many people are actually researchers. I never knew that. I was thinking about things, well, you're in a lab and you're doing your research and things are time sensitive. And if you're all of a sudden your research is cut off, there goes all your time sensitive. And, you know, so it's not just an easy way. How do you get that information out there to where people who, for whatever reason, can't handle something that's complex?
Well, you also have to reason what we are.
Jill, if you're speaking, maybe you could turn
We
off
don't
your
care about
camera
rule of
because
law because the law right now is doing what they.
it's hard. You're breaking up, and I'm wondering if it's a bandwidth
Yeah,
issue.
my phone was ringing at the same Okay, can you hear me now? I was just
Yes.
gonna say, the people who we are reaching don't care about those particular, more philosophical things that we care about. They care, and so even though the rule of law, the possibility of the rule that, the elimination of habeas corpus, all those things are, driving us nuts. It may not drive other people nuts because the person in power is doing the things that they want him to do in many respects. They want the immigrants to be thrown out of the country. They want these things. So we got to figure out what it is that they need or they don't like. And it isn't going to be the things we think are the most important, unfortunately. So we got to, our frustrations with some of these things kind of have to stay within the group, because I don't think they help too much when you go outside and try to pick up the others. Maybe not, but.
So how do we pick the issues that other people that I can't imagine what their issues are because they're not my issues. So how do we find this out? We go to the polls. Polls aren't always right.
No, I don't know, but
Do you think we
Yeah.
should,
Right, Karen?
I do think we should recognize the successes we've already had. Getting 4,000 people on April 5th. I bet on June 14th, we're going to have 2,000 people at F&M Park. The fact that now the passers-by are more with us than against us. I think we need to recognize the sea change that we see and go from there. Will we get everybody? Oh, heck no. But will we get the majority? I feel pretty confident that we will, actually. I do feel very hopeful that when I'm at the demonstrations and I'm talking to people and I see the people in the cars, it's looking better than I've ever seen it in Traverse City. So I'm hopeful.
Yeah, I just have one comment. I know we're going way over. I agree with you, Sam, because we've done some Traverse City demonstrations and definitely is a very different response than I had expected. It's much more positive. But, this, I'm going to sort of comment a little bit on what do we pick? What do we say? How do we get to people? And this is going to sound a little harsh, but I really think we have to focus on the magnifying glass and not the crystal ball. In other words, I really think that we have to look and understand what is happening to people around us. How are they being affected? Let's just take Medicaid, for instance. Once people start losing benefits, once there's things get cut, whether it'll happen or not, I don't know. But to warn them that's going to happen, it's not going to work because they don't believe it. They just think, oh, he's just talking. They're not going to do it. But I think to magnify what has already happened, and that's just an example, rather than go out there and look for something that we think is going to happen, but may not, because they're not. It's like crying wolf. They're just not going to pay attention. So I really think if we think of things like that, that may help us focus.
I also really want to thank Mickey for your incredible knowledge that you brought to us this evening. I definitely want you on a podcast. I'm going to be arranging that soon, so don't be surprised. But
don't run away.
Don't run, stay in town. Yeah.
Before we go, Sam, what are we doing for so I missed one when I was in Washington, but I appreciate hearing what other people have to say. And what chapter are we potentially going to read next?
Rick and Karen, any ideas on that?
I really was thinking about that today, and I'll go back to the idea of what is important to me may not be important to someone else. I mean, if it were me, the next chapter we would read would be the Department of Justice. And hopefully we'd be able to find someone to lead us to kind of separate the real from the imagined in terms of what's going on. But there may be there's housing and urban development. There may be other areas that are more important and, would resonate more with people in Leelanau County. So we had talked about that we would meet once a month. I don't know whether I don't know how it works in the summer. I know everyone gets busy and, maybe we might take a month off. I don't know. That's something, Sam, I would talk to you about. But I think really where we should go next is we should really be thinking about who can lead us in some of these really important topics, because I'm a teacher. I felt that I felt comfortable leading the education chapter. But when it gets to the law, I'm not a lawyer. And I really don't feel comfortable there. And so I think before we decide what chapter we're going to do next and when we're going to do it, we need to think about who could lead us in areas. But I would say, um, uh, I'd really like to hear from some people about what's going on with the Department of Justice. I mean, it's absolutely unbelievable. And I believe that this book supports what's going on at the Department of Justice. If you read that chapter, I believe I believe that they do. They're really after the handmaiden's tale. I mean, that's what the Heritage Foundation is about. It's about Christian nationalism, and it's about nuclear family, period, the end, case closed, and everyone else can just be flushed.
Yeah.
It's a tough call. I would need some help in deciding what would be the best place to go next.
Okay, let me ask you. So we had Miriam Kronkowski, who could certainly lead the justice, but we also, you remember I told you about the film I saw with the guy who was traveling along the California-Mexican border. I don't know if I talked about with you about this. So this man did a bicycle trip and ended up in a city where it was one of the most horrifying things I've ever seen. This small town where these three big trucks come in and a big bus with flags and God and family on it, and they do a religious revival of what a family is and how God gave us the Constitution and how they are the patriots and how we are traitors. So we could go two ways. We could try to get this guy to do his film, but we'd have to fly him in from Minneapolis, or we could just go with Miriam Kronkowski, a homegrown lawyer. So let's see if she just, and Marion just says, when is it? So looks like she might be on board. That might be our easy answer. Any suggestions?
Just let me interject here. The Claremont Institute is probably the most egregious of all of these think tanks. And in fact, Catherine Stewart has written a book called Money, Lies, and God, which is a heavily detailed examination of the Christian nationalist movement here in America.
Wow, that's incredible, Marty. Can you, so could you send me that information?
Yes.
Okay, do you know my email?
Yes. I've got it.
Yeah.
Okay, so I would, that sounds amazing. So guys, do you want to vote on that, or should we just see who's available?
Sam, I have a question. Do you think you can get the bike guy?
I think, yeah, I talked to him at the Rural Caucus. I have his card. I'm pretty sure I can get him. I'm just not sure of the date. And I was gonna, Bridget, because we both saw him together. It would be a combination of Leelanau Dims and Leelanau Indivisible. And I was thinking we could show it at the Bay, at the State, and at the movie theater in Elk Rapids.
So it wouldn't be a book club presentation.
No, it would be larger. It would be larger.
Right. So Well, yeah, let's hear from other people, but it sounds like our next one maybe would be the Department of Justice.
Yeah, so let's see what Marion has to say. And if we can't get Marion, we might be able to get Mike Naughton, who did our meeting on Saturday. He's an ACLU lawyer from Traverse City.
Boy, he's fabulous.
Yeah, he's great. He saved me from my little snarfle with the enterprise.
Well, what do people have to say?
Karen, what's your opinion?
I really like the idea of the ACLU guy.
Okay, Kevin, how about you?
Yeah, I think that'd be great. I'm interested in the
Mike?
Justice Department.
Okay, Kathy? You're muted.
Can't hear you.
I'm sorry, I had clicked on a link and it started talking and I had to mute it and then that muted you guys. What's the question?
For the next meeting.
I'm up to whatever you guys want to do. It all sounds good.
Okay, Mary Ann, your vote?
No, I like focus on Department of Justice. I think that's a good one.
Okay, Carrie?
Department of Justice, you guys are, like I said, I'm just listening to you. I'm the ears in the darkness.
Yeah, you still get to vote. All right, is there anybody I haven't called on? Becca, are you there?
No, Department of Justice would be great. That's where a lot of the stuff is happening right now.
All right, so it looks like maybe that's where we'll go, Rick. Is that okay?
Sounds great. Yep.
Okay, Mickey, I just can't tell you how much your knowledge and your work means to me personally and probably to the planet. So thank you so much for what you do. Thank you for leading us tonight.
Thank you for the opportunity. I hope people got something out of it. I certainly did. And as a person who thinks in terms of images, I'm looking forward to making some signs for the June 14th event.
June 9th, we'll see everybody at my husband's workshop on West Bay Shore. Making signs. June 9th, we'll make making signs for June 14th. Okay. Thank you, everybody. Have a good night.
Good night.
Thank you.
Thank you.